Hello and welcome to another edition of Exclusive Interview coming to you from 84 TV Radio Abuja, Nigeria. My name is Stanley Bentu. Now, it was December of 2019 and I was having breakfast while news started filtering in that there was a strange virus that was spreading across the city of Wuhan, China. Fast forward 2 months later, and this virus was not only all over the world, but we had to stay home. Wow, it was quite a traumatic experience. And who was to know that this news that was filtering in just a few months ago was going to directly affect our lives, both health-wise and pocket-wise? Well, that was the coronavirus pandemic, and it's been a little over a year since it all began. How well have we fared? What has the NCDC done, and what is it still doing to make sure that Nigerians are safe? That's what we'd like to find out today. But before we do that, let's have a look at this report.
This month marks the first anniversary of the government's decision to ask all staffers to work from home. Looking back on that announcement is like looking at a time capsule. There was a strong focus on cleaning and sanitization. Air and interstate travels were cancelled. But most notable is that initially the shutdown was scheduled for just 2 weeks. It eventually lasted nearly 3 months and led to an economic recession. The past year has transformed nearly every aspect of our world. Seemingly overnight, our friends, family, colleagues and communities had their lives changed in critical ways that promised to have much longer lasting effects. Living through a global pandemic has driven dramatic shifts in our jobs, eating habits, childcare, and even our collective sense of time. What lessons have we learned from the past 12 months, and where are we in the fight against COVID-19? On Exclusive Interview today, we speak to Dr. Chinwe Lucia Ochu, the Director of Programs and Knowledge Management at the Nigeria Center for Disease Control. She is a clinician with over 23 years' experience. She represents NCDC at the National Lassa Fever Research Consortium, National Health Research Committee, and National Health Research Technical Working Group. She is involved in the development of a national research for health agenda for Nigeria, with identification of health research priorities. She is also involved in the development of Nigeria's national plan for integrated zoonotic disease surveillance and research in animals, as well as in the development of National Ebola Virus Disease Contingency Plan for Nigeria. Dr. Ochu has represented Nigeria in international discussions that bordered on the advancement of Accelerator 5 of SDG 3, R&D Innovation and Access.
Welcome back to Exclusive Interview. Joining me in the studio now is the Director of Prevention Programs and Knowledge Management from the Nigeria Center for Disease Control, and her name is Dr. Chinwe Ochu. Dr. Ochu, it's a pleasure to have you here.
Thank you, Stanley, for having me.
Now, it's been 1 year since, or a little over a year since COVID-19 shook the world. I can't think of any other words to describe that. Can you give us an overview of our journey so far, the year, right from the beginning, when it first hit the country up until where we are now?
Yes, you're very right, Stanley. It's been a most disruptive experience. The COVID-19 outbreak met all of us, took all of us unawares. But before that outbreak, Nigeria already had NCDC in place as a National Public Health Institute with that mandate to protect the health of Nigerians, more of health security. And we had been responding to other infectious disease outbreaks. In fact,
the most famous one was the Ebola incident.
Ebola was quite far off. That particular year, January that year, we were already having the the largest Lassa fever outbreak in the country. And we're dealing with that. The beautiful thing is we already had a system in place. The incident management system, that brings together various stakeholders to respond to an outbreak with the various pillars of response. So we're doing that, and that was what helped us at least to be able to manage that first case as we detected it in the country. Now COVID-19 all over the world disrupted a whole lot of things, and was like the most challenging experience we've had so far as an agency.
The most disruptive event of our lifetime.
Of course. But it has also provided great opportunities that we've never had such in the country before. As an organization, we're able to achieve a lot of our targets. For instance, before the COVID-19 outbreak, we had just 2 to 3 molecular laboratories that could test. But now we have over 100 all over the country, in every state of the country. So we can boast of being able to detect, test molecular diagnosis using PCR in all the states of the Federation. We also had this digital surveillance system that we call SOMAS, that enables real-time reporting of cases as you detect them. So with this outbreak, we're able to roll out SOMAS to all the 774 local governments of the country, in all the states and all the local governments. And we even have SOMAS in the laboratory. So as people, cases are coming at the communities, the primary health care centers, surveillance and notification officer in those places are imputing it into SOMAS. And right there in Abuja, in all the state PHUOCs, we are looking at the dashboard and seeing the numbers as they rise. So that is the beautiful part of that. Then the EOC, the Emergency Operations Center, that is the incident management structure where you bring in all the relevant stakeholders in the various pillars to respond to an infectious disease outbreak of public health importance. Prior to the outbreak, we had it just in about 21 states, but now we have it in all the states of the Federation. We have built our capacity, even the infection prevention and control capacity. All the tertiary health facilities in the country have had training on infection prevention and control. And most of them now have IPC committees. These are the things we were trying to achieve before the COVID-19 outbreak, but we're not able to do that. So a lot of strength has come into this. Talk about risk communication. We have developed a robust risk communication and community engagement strategy that helps us to, it's now community-driven risk communication. So you start with the community developing your risk communication messages, and then they identify their own strategy and their priorities, and you make use of all these community volunteers, gatekeepers, and influencers in driving those communication about risk to their own people. So it's a very wonderful and fantastic strategy which we have learnt from this COVID-19 outbreak. So we have
it's a pandemic that has brought a lot of progress.
One key thing this pandemic did for us is this overwhelming awareness towards health and this all of society approach in responding to health. Prior to this period, people thought health security issues had to do with health sector.
Precisely. I was even one of those who was an advocate for health to be pushed up in public discourse, because whenever people step up to say they're seeking public office, people want to know, oh, we want jobs, we want security, but very few people talk about health. And I always say that the average Nigerian, from upper middle class downward, we are all just one serious illness away from bankruptcy.
You're right.
So if this has done that, then probably something good has come out of this pandemic.
My sincere wish is that Nigerians, we have learned from this process that health must be a political choice.
It must
Meaning we choose our leaders based on their own health promoting agenda. What plans do they have? So we cannot... we have learned a lot from this experience.
Which is my second question.
Yes.
What have we really learned? I mean, from a layman's observer point of view, I know one of the things we've learned is we can't keep Nigerians at home for a prolonged period of time because we basically make our living day to day, and if we can't go out. So I know that the NCDC has had to be more creative in its response, in its attempts to keeping the figures down. So what have you learned?
I think there are very many key lessons that we have learned from this outbreak. Number one is the importance of preparedness. So investing in preparedness as a nation will be more cost effective and more helpful to us than just waiting for the outbreak to happen before we start putting things in place. So for instance, we had this pandemic influenza plan that had outlined what we're going to do in case we had a pandemic influenza outbreak, and that was what we quickly activated during this pandemic, the COVID-19 outbreak. So having such a plan and being able to implement it and put structures in place that will enable you to respond, like contingency planning during an outbreak, is key. Secondly, the power of coordination. I think this outbreak, brought high-level form of coordination to responding to health security issues. We had the presidential task force with the office of the president himself overseeing that, and that provided that strategic leadership, like more or less rallied everybody together for this one common purpose, and that was what we did. So it is very, very important to have proper coordination for health. And then this multi-stakeholder involvement. Everybody, we have learned now that health is everybody's business. Down to the man on the street has a role to play in keeping ourselves healthy. And then, of course, budgeting for health. That is a lesson that I hope we have learned, that we need to invest on health. Because without health, you've seen that the issue of health has brought even big nations to their knees. So your businesses could not run. Nothing else mattered except being healthy and safe and staying alive. So everybody must be involved. That also brought up the issue of the private sector engagement in health. With this outbreak, we had a coalition of private practitioners that came together, business owners led by Dangote. They formed the CACOVID, Coalition Against COVID, and they were able to mobilize resources that helped to support the work. So it's critical. The role of the private sector is very critical in this. And of course, we have also learned the importance of trust, public trust, in any of our government public health interventions. You see how misinformation was driven because people didn't trust the government. So even when we were saying the truth, telling them the truth about them, with scientific evidence,
just didn't want to believe it.
No, because of
even with the evidence,
glaring you on the face.
So there's been a trust deficit for a very long time.
And that trust is driven by community engagement. If we're able to be transparent and engage the community in every level of our policy making and decision making, it builds that trust and makes people to know. And then of course you are faithful to do what you say you would do. Whatever you are doing, the trend that you put in place is going to affect how people take you serious in the future. So it's very, very important that we learn that lesson and we'll continue to work transparently. NCDC has been doing that since the outset of this outbreak. We've been releasing data, keeping Nigerians informed, engaging them.
So where are we, a little over a year later, where are we in the fight now? We've seen some countries that are kind of turning the corner and maybe starting to open up. Where is Nigeria?
I think God has been faithful to us and we have made tremendous progress. We've gone through the first wave, the second wave, and now we are seeing continuing declining in the number of cases. There's a lot of community mobilization for health. People now know about, even the old woman in the village knows about hand sanitizer, knows he needs to wash the hands. So a lot of that awareness. Yes, we had that resistance where people, because of some of the discomfort you have when you wear face masks, and because people felt it was a hoax, there's nothing like COVID-19, so people were not adhering, so to say, to NPIs, the non-pharmaceutical interventions. But currently you see that the awareness is quite high. All the surveys,
what would you say is responsible for the drop in confirmed cases on a daily basis? We went from doing about 1,000 plus to I think we're right about 100, 150 per day. What's responsible for this drop within this month?
Yes, I think the drop has always been attributed to the non-pharmaceutical interventions, because this is a highly infectious virus, and the only way that everybody is 100% sure that it works to keep this virus, the spread of the virus down, is by observing these clear non-pharmaceutical intervention protocols of distances. You can see that we are not sitting close together, wearing a face mask when you go out, washing your hands frequently, observing respiratory and cough hygiene, making sure that your hands are washed, you avoid close contact with people, don't shake hands and all those. So these are strategies that been shown to work in all the countries where this pandemic was recorded. And
one of the things that I will be happy to have continue once this pandemic is over is the non-shaking of hands. I don't miss handshaking. and the reduction in handshaking, certainly it has even helped with other coronaviruses, reduce the spread of that. So, well, we will take a break now, but when we come back, we'll talk about other issues, including the fact that we have other variants of COVID-19. So don't go away. We'll be right back. There's a wind of change blowing over Nigeria, and it's coming from the Tertiary Education Trust Fund. If you want to find out how TED Fund is bringing the Nigerian government, industry, and the academia together to drive a new knowledge economy, tune in to this station every Wednesday at 8 p.m. for TED Fund, The Paradigm Shift. It's informative, it's innovative, and it's exciting. TED Fund, The Paradigm Shift, proudly produced by 84 TV Radio. Welcome back to Exclusive Interview. I'm still in the studio with Dr. Chinwe Ochu of the Nigeria Center for Disease Control, and we've been looking back at the coronavirus pandemic as well as some of the new developments, our victories, our challenges, and one of the challenges that we see, one of the emerging threats is we keep hearing reports of new strains of the virus emerging. We have the South African strain, the UK strain, and all of that. Do we have a Nigerian strain?
Well, I think the issue of having different strains of the virus is not strange, actually, because it's not just restricted to COVID-19. All viruses mutate. And that is not, for COVID-19, we've seen these disturbing cases of other variants. But mind you, some of these variants, even though they have higher transmissibility, but the severity of outcome is not aggravated by these strains. For Nigeria, we have not had much of these variants. We have detected some of them, especially the UK variant, but we've not had any evidence to show that those were the variants responsible for the spike we had in the outbreak. So the problem is not with the variants. The problem is to understand that so long as this is a virus, the same method of prevention for one will work for the other. So these same NPIs that I spoke about before the break will also be responsible for keeping us safe no matter the variant in the country. So what is the variant? Is the virus is developing its own survival strategy, changing some of its forms.
Developing its own vaccines against our treatment.
Yes, because it wants to survive. And most of the variations have been seen and noticed in the spikes. The spikes are those projections from the virus to the attach and penetrate into the human cells.
So the current vaccines are still, to a large extent, effective against these new variants?
Of course, because the vaccine is targeting various points on the virus, not just one. What the vaccine does is to stimulate your immune system to develop relevant antibodies against the virus. It's not the virus itself, it's just something that either a dead virus or something that mimics the virus and then triggers that immune response that will help you to develop enough antibodies to fight against the real virus. So that is what, and that has been the strategy with vaccination right even before the COVID-19 outbreak.
And I know that the primary health care is principally involved in the vaccination of the Nigerian public. But what can you tell us about the vaccination and the strategy and how do vaccines even work?
Yes, like you said, it's the National Primary Health Care Development Agency that is responsible, and they've done that great work of at bringing in the vaccine. You know, when it all came out, it was like, are you sure Nigeria will ever have a vaccine for its people? But now we have the vaccine and we're beginning to roll it out, prioritizing those that are at high risk. The healthcare workers, the frontline workers, we want to keep them safe while they respond. And hopefully when the next batch comes in, we'll keep extending until it gets to as many as should have this vaccine. So how does it work? Like I said before, the vaccine is not the virus, but it's something that has some characteristics of the virus that can trigger the immune response of the body. The immune response is, like we call it, the policeman or the soldiers of the body that fight against foreigners, foreign invaders, as they come into the body. This time, the COVID-19 virus is detected as that foreigner that needs to be fought. So the cells of the body generate these antibodies that will now block those sites where the virus is supposed to attach and penetrate into the body. So we have different kinds of vaccines, but all of them work to generate antibodies against the virus. And what the vaccines we have now, they are for emergency use, and they've gone through various testing and evaluations, and the regulatory bodies of various countries, including our own, have shown that this is safe for our use and is also effective. So that is what we're doing. And
what has your experience been with attitudes towards vaccinations? Because you know, first of all, you talked about misinformation earlier, and I've heard more than one conspiracy theory. Oh, Bill Gates wants to reduce the population of the world. This and that and the other. There is so much, but. What has been your observation about the attitude of Nigerians towards being vaccinated against COVID-19?
It's actually not surprising that we are having these kind of misperceptions on the vaccine, because the virus is a novel one. We've not had this kind of virus before. There's still, though we know more now than at the beginning, but this conspiracy theory around the virus that started with the virus itself has extended to the vaccine. So people are apprehensive. All they need, we fight misinformation with facts and evidence. And that is what you present to people that will convince them that truly what you're saying. And every rational person will be able to look at the evidence and know whether what you're saying is true or not.
But that's tough, because I've heard a full range. I mean, anything from population reduction to it makes you impotent, to there is a computer chip inside.
I may ask
want to know where you're going. So a wide range.
So Stanley, have you seen cases of sterility from this vaccination?
Absolutely not. As a matter of fact, all of the people I know who have been vaccinated were very pleased that they were, and it was a thing of pride.
Yes, in the country, we've had a lot of people vaccinated, and we haven't had any such record of adverse effects that people are complaining about. So as far as we know, this vaccine is quite safe, and not just that it's safe, we're also keeping an eye on it. So there is this active surveillance that is going on. NAFDAC has rolled out the app that you can use to track all these advanced events. So the country is working closely to make sure that we don't give anything that will harm our people to them.
What about in the future? Because we have to look at the post-COVID era. We've been through this, so we know it can happen, and we know that there are still dangers out there, especially from zoonotic diseases as our environment changes. What about our vulnerability as Nigeria, as a nation? If the world had gone into some kind of vaccine nationalism and people were protecting their development, that would have left us terribly exposed. So are there collaborations in the works, say perhaps our academia and NCDC and NAFDAC to see that we have our own homegrown defenses?
Great. I think that is one key success story that we have that I didn't mention at the beginning. The fact of being able to bring scientists together with policymakers. We have a coalition, a research coalition we call the Nigeria COVID-19 Research Coalition that was set up at the beginning of this outbreak as early as April 2020. And we've working in collaboration with National University Commission and with the Tertiary Education Trust Fund, as TED Fund, and Manufacturers Association of Nigeria, and the National Economic Summit Group, as the private, representing the private sector. So we're bringing all these key persons, with persons from research institutes, some these agencies like NIMA, National Institute for Medical Research. We have NAFDAC there, we have NACA. So you can imagine this coalition of scientists coming together with policymakers to try to see how we can identify indigenous solutions to this problem, and also to promote good science and contribute to knowledge around this virus, the global knowledge around the virus. And a lot is happening. Down up to trying to see whether we can get our own indigenous vaccine in the country, because we cannot continue to be dependent. That is one big lesson we have also learned, that as a country we must invest in research and innovation and support our scientists to be able to explore those indigenous solutions to our own health problems. Like you rightly pointed out, nationalism is a big issue, and we don't know what lies ahead. So we need to strengthen our own health system and make sure that we're able to address our own problems.
Well, Dr. Ochu, I wish you all the best, and I wish you all the success in the world, because when you succeed, we stay safe, we stay healthy.
Thank you very much.
It was a pleasure having you.
Let's keep praying, let's keep trusting God, and let's keep doing our best to stay safe.
Indeed. We'll be right back.
The typical African woman does not believe in the capacity she carries. We have a lot has been deposited in us. We have to accept that those things are there.
There are so many programs there to support agriculture, but women are not accessing it because of collateral.
We need to carry the grassroots women along, because they are the ones who do production. Sometimes the lady at the grassroots needs some kind of push and a kind of expansion on how best to take this product, where she make a fantastic profit.
It's about repositioning our ways of doing things. We are forgetting our tradition and culture in Africa. Parents need to go back to being parents. We need to keep advocating for girl-child education.
A very enlightening conversation we had there with Dr. Chinwe Ochu. But there is something that she said that stuck with me, and it's something that I have echoed several times, that health is a political issue. 2023 is not too far away. So when politicians come to your doorstep seeking for your vote, make sure that you ask them about what plans they have for the health sector. We have promises and declarations that our country was going to invest as much as 10% of our national budget every year to improve healthcare. Has the government done that? And how can it continue to do that over the years? That's something that we should really be concerned about. And that's it for Exclusive Interview on this edition. Join us again next time. Until then, thank you for stopping by.